Guys, hello family, hello friends. This is Dr. T and welcome to yet another video. So we are continuing with our ECG series. So in this video we'll be talking about how to calculate. So basically it's the approach to interpreting an ECG strip. So and I said yesterday that many people have got their own approach. Many people disagree with some approaches, and then other people prefer certain approach to an ECG. So yeah, now the one that I'm very most comfortable with is the one that I'm going to be showing you. I remember I'm still also learning how to interpret ECGs and all of that. I'm still learning medicine as a whole. So by no means I'm saying I'm the best or whatever. Yeah, just I've got a passion for teaching, and that's it. I don't think I will ever share any information to anyone if I'm gonna wait for me to be perfect or to know everything. Because the truth is that there is no one who knows everything. Anyway, so the approach that I get my strip. Like I was saying yesterday that I believe in the rhythm. Actually, the rhythm, it's actually a pattern that I'm talking about here. It's not the detailed rhythm, which we are going to talk about in another video. But it's just, I'm going to show you what I mean by a pattern. Because at this point, you just want a pattern of the rhythm. Number 2, it's the rate. Number 3 is the axis. We have already discussed about the cardiac axis. Those are the first 3 things that you need to find out. Then move on to the other parts of the ECG, right? So I said yesterday that many people, when they get a strip, they always want to figure out the rate first. And you trying to calculate a rate, like I was saying, that the method you're gonna use to calculate the rate, the heart rate, depends on the pattern of the rhythm. You don't want to use a wrong method to calculate your heart rate. You want to use the correct method. And what do I mean by that? So right now, when it comes to the pattern, what you want to find out is, are you having a regular heart rate? Are you having an irregular heart rate? I'm not going to get into the regular, irregular, or regular, irregular, no. We're going to talk about those later on. That's what I'm saying. We just want the pattern. As long as it's irregular. All we want is it regular or is it irregular? Not the irregular, or regular, irregular, or all that kind of technologies. So this is what we want to know at this point. Now I'm going to show you the easiest method of trying to figure that out. So what you do, you have your ECG. Nothing is drawn to scale here, guys. Nothing is drawn to scale. I forgot another wave there. So you got your Okay, so what you wanna do, you want to go to your rhythm strip. Go to your rhythm strip. A rhythm strip is an elongated lead 2. It's still lead 2, but it's just been recorded for 6 seconds. Most of them, if you look at the ECG, you'll find that all the other leads, they are shortened. Their ECG's tracing is shortened. But if you look at the rhythm strip, it's the longest. It's usually the longest. So it's usually lead 2. So that's the rhythm strip. So you go to the rhythm strip. Try and figure out your R wave like that. Look at them, and if you have a ruler, use your ruler. Whatever that you can use, that is easily accessible. But personally, what I usually do is I take a piece of paper, and I go to I usually like the QRS, but for this practice, it doesn't really matter. But if you can find a QRS that is on a solid line, you know those solid lines for the big boxes, target that one. But if you don't have it, then it's still fine, because it's irregular anyway. But you put a piece of paper like that. That's your paper. And then, let's say your paper is like that. That's your paper. You just make the markings there, and then slide it across throughout the entire rhythm strip, which is about 6 seconds. If it's fitting, these lines are in line with your RR every time, then you can be happy. Go drink coffee, you've got a regular heart rate there. That's what you want. If, as you slide your piece of paper, you find that on some RR waves, you get so they don't fit nicely. So you get a situation like this. Let's say this is your R, and then this is your R. Now you get a situation like this. Your paper, what it does now, it does this. So your mark is here. So it's not fitting nicely. It's not well aligned. Your marks that you made with your pen are not well aligned with the RR waves. Then, if it changes all the time, then it means that you have an irregular heart rate there. Why is this important? Okay. That's what I'm saying. At this point, we are worried about the pattern. Just the pattern here. Just the pattern. So if it's regular, now, like I was saying, the method that you're going to use to calculate the heart rate depends on whether the pattern is regular or irregular, whether the rhythm is regular or irregular, right? So, let's say now you have, so we know now that we've got a regular heart rate. We don't know the exact heart rate, the exact number. We don't know the exact number, but what we know is that we've got a regular heart rate. So there are two methods that we can use now to calculate the actual rate. The first method is called the 300 method. The second one is called the 1500 method. Nothing hectic here, guys. Nothing hectic. So what you do, for the 300 method, your heart rate is going to be equals to 300 divided by the number. Let me just do for the second one as well. So the heart rate here is going to be 1500 divided by the number of small squares. Small squares, large squares. So guys, it was discovered that, I'm just trying to explain now the 300 and the 1500. So it was discovered that 1500 boxes are equal to a minute on an ECG, and the large ones, 300 of them make up a minute on an ECG. That's why, so the 300 is standard, the 300 is standard, the 1500 is standard. Just need to memorize that. So now, remember on an ECG, we've got big squares, and inside the big squares, there's got about 5 lines there. There's 5 small boxes. 1, 2, 3, 4, 5. So this is a large, a big box, and inside it's small boxes. So if you have an R right here, and also again try to target, if you have, try to target a box that starts on a solid line. Let's say now this is our R. This is our R. 1, 2, 3, 4, 5. And then right here we have our another R. Right? So if we are using the 1500 method, what you're gonna do is that from one R wave to another R wave, you just count those small boxes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. But if you have got one large box, like there's 3 of them, because you know each large box is about 5 boxes, small boxes, 5 small boxes. So you can just say 5, 10, 15, just like that, because you know it's 5. But now I'm just trying to demonstrate. And this is the method that I like. And I will tell you why I like this method. So, you know, it's a solid line. So this is 5. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So here we're going to say 1500 divided by 10. If you cancel out the zeros, that's about 150 beats per minute. So by definition, this patient has got a tachycardia. Whether it's sinus or not sinus or whatever, those are the things now you can look at later. And when you go back to your P wave, your QRS, and see is it wide, all of those things. But at this point, you just want the basic information. Don't overwhelm yourself with so many things. Just take it one step at a time. So I'm gonna repeat. What you do if you are using this method, the 1500 divided by small boxes, you look for an R. So this is regular, right? This is regular. The reason why you can employ these 2 methods only when the heart rate is regular is because if it's 10 here, you expect it to be 10 throughout. You don't expect that the next RR interval is going to be like 3 big boxes now or 4 big boxes. So if you do it for 1, because it's regular, you know that it's going to be 2 boxes throughout. So that's why it's safe to employ these 2 methods. That's why you can't employ these 2 methods when the heart rate is irregular, the pattern is irregular. Okay, so like I was saying, what you do, so you have figured that, okay, you've got a regular pattern, the rhythm is regular. target an R, look for a box that starts exactly on an R, and then calculate the number of boxes going to the following. So it's called the RR interval, right? So it's called the RR interval. So make a mark and count the small boxes from that R that you have identified to the next R. Whatever that you get, whether you get 15, you get 21, whatever that you get, come and divide it with the 1500, which is the standard number. The reason why, look at this now, if you take 1500, because I said 1500 small boxes is equals to 1 minute. So you are able to say whatever that number that you get there is going to be beats per minute, because that 1500 is small boxes, and it's been figured out that it is equal to 1 minute. So now we've got 150. So then we got 10 small boxes. Even if we had other numbers, we'll still get a good number. We'll still be able to calculate. In some cases, we'll find that these boxes are 15. There are 15 small boxes. There are 4 small boxes. I mean, here we've got 2 big boxes, but we've got 10 small boxes. And the target is 10 small boxes. Okay. I'm going to use the same method now. Let me just see if I can clear this out. I want to show you something, guys. So we said the heart rate is equals to 1500 divided by the number of small boxes from one R wave to another R wave, called the R interval. So the number of small boxes that we got there, we got 10. And then if we cancel the zeros, we are left with 150 beats per minute. So this person or this patient's heart rate is 150 beats per minute. Now, let's look at this one, this method. Say now, our heart rate, so we're going to be using 300. So, when you use the 300 method, you divide with the number of big boxes. Like we've got 2 big boxes here. In case you guys cannot see it nicely, but we've got 2 big boxes here. This is where the first box ends, and then this is where the second box begins. So what you do, you just count them 1, 2. There are only 2 in this case. So divide that by 2. And then 300 divided by 2 is 150 beats per minute. So it doesn't matter which method you use. It doesn't matter which method you use between these 2, as long as your heart rate is regular. As long as the pattern is regular, you can use either of the 2. Now I will tell you something that I often meet clinically that tends to throw people off. And this will explain why I was saying to you guys that personally I like the 1500 method. Oftentimes you encounter a situation whereby, okay, this is our P. Once more, guys, nothing is drawn to scale here, so please don't crucify me for this. Okay, now what often happens is that as you, let's say now I got a strip and I did my quick assessment to see the pattern using my paper method. So now let's say here I get 2 big boxes. Let's say I get this is what I want to explain. I get something like this, right? 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. So guys, look at this. If you can pay attention closely to this, you will see that right here I've got a big box, right here I've got a big box, right here I've got a big box. But my big box doesn't end with the R interval, or with the R wave, sorry. Doesn't end with the R wave. So the 300 method is gonna give you issues, because now you will be like, okay, I'm gonna calculate this patient's heart rate. You will be like, okay, heart rate is equals to 300 divided by, then you're like, okay, 1, 2, 3. Then you divide by 3. But you're gonna get an incorrect, it's gonna be close, but it's gonna be incorrect because you left about, let's say, 1 small box there. Just because it was not on an R wave, so you didn't know what to do with it. That's why I'm saying, in cases like that, the 300 method becomes inaccurate. So that's why I like to use, every time I just like to use the 1500 because it fits everywhere. So I can now say, this is 5, 10, 15, so this will be 16. So now I can come here and divide, change this formula, put 1500, divide by 16. That's when now I can get a correct reading, a correct number, right? So I just want to repeat what I'm saying. The 300 method is good when your big boxes, they are well aligned with the RR. They don't overlap the RR, the R wave. But clinically, that's very rare. So you're gonna get confused if you want to use the 300 method. So rather get used to the 1500 method, because that one, even if you've got 2 extra small boxes overlapping, or you can still count that and get an accurate reading there. So now let's say, so I'm saying, okay, I like this method more. Let's say now you've gotten this strip, you got your pattern that actually told you which method to use, and you have gotten your X's already. So you've got about 1, 2, 3 things that you can tell, that you can report on your ECG. You've got 3 things. You know the X's, you know the heart rate, you know whether it's regular or irregular. But now let's say it's irregular. How do you calculate? So there's a different method for when it's irregular. It's called the 6-second method. The 6-second method. Okay guys, I don't like having long videos, right? So we have about 20-25 minutes already. So I'm gonna make a separate video for this method. And then also we're gonna further, because remember, once you get all of this and you find that, let's say I find that I'm reporting now on all of this. Firstly, I say my rhythm is regular. My rate is 120. And I've got a normal axis. So moving from here, you want to go and check your P waves. You've got a tachycardia. The definition of this is tachycardia. So now you want to classify your tachycardia. That's when now you're going to need to go and check your P waves, check your QRS, and once you get you check your. We are going to talk about what sinus rhythm is on another video. But then that's when now you can tell whether you are dealing, what kind of a tachycardia are you dealing with. But what I've just given you now is the basics, the entry level of interpreting an ECG. Don't be overwhelmed, guys. Don't just take things very slow, and I'm sure you're gonna be fine. I'm sure I'm gonna find this is a method that I've been using since I was an intern. So most of the times I do get these things right. And the nice thing about being a doctor is that there are doctors who are always ready to assist you. My ECGs, when I do an ECG where I'm working right now, I interpret it and I still send it to one of the doctors in Nelson Mandela to help me interpret it. Most of my patients, they take them because I usually speak to this other doctor, the cardiologist. So he would ask me to send the patients for an echo because he has seen a problem as well. So one thing that I also want to say is that you don't have to know how to interpret an ECG to actually do one. As long as there are people who can interpret it for you, you are fine. You are fine. As long as there are people who can interpret it for you, the danger would be not to do an ECG even and then you find out later that you were supposed to do an ECG for the patient. So the fear of not knowing how to interpret an ECG has never deterred me from actually doing ECGs. I've done ECGs, like even when I was a medical student, I would do ECGs without understanding what I'm doing. But I just knew that I just need to place those leads correctly. Someone will come and interpret the ECG. Okay, guys, let's meet in part 2 of this video.